A very warm good evening to one and all. Welcome back to today's session. Today our guest speaker name is Anita Lobo ma'am from Father Muller College. And coming on to the small introduction regarding the Anita ma'am. Ma'am is currently working as a professor in Department of Repertory in Father Muller College, Father Muller Homeopathy Medical College, and unit head of obstetrics and gynecology in the Father Muller Homeopathy College and Hospital. And ma'am has a teaching and professional experience and of 28 years. And ma'am has been also a examiner and paper setter in Rajiv Gandhi University of Health Sciences, Bangalore, Karnataka. Vinayaka Mission Deemed University, Salem, Sri Kamakshi Devi Homeopathy Medical College Hospital, Goa, NTR University, Vijayawada. And ma'am has also did various publications in various reputed journals and peer review journals. And ma'am has also been attended various conferences. We welcome you, ma'am. Welcome to all the participants also from Team Aisha. And session is hand over to you, ma'am. Thank you.
Thank you, Dr. Lavanya, for your nice introduction and being so good to tell about so much about me. Yeah, I would like to start the session now. Nowadays, what we commonly face is in this era is lifestyle disorders, and particularly in the younger age group, we see that in PCOD, infertility, female complaints are seen more often, particularly even endometriosis, chronic PID. Am I audible? No? Okay. So I will directly start with the topic, like without wasting much time.
Ma'am, you are audible, ma'am.
It's very
Yes,
nice of you all to give me such a platform where I'm, where you have given me a chance to express my thoughts on this important topic, like which I wanted to share with all of you all, especially the cases where we have had excellent results with in our system of medicine, along with yoga and along with other systems of medicine. I first, like, can you please share the screen? Can you please share the screen? Dr. Lavanya.
Yes, ma'am. We are about to share, ma'am. Kindly give us a minute, ma'am. Yes, ma'am.
Okay. I'm also very grateful to Dr. Kingshuk, National General Secretary ASI, who has taken all the trouble to keep in touch with me ever since COVID began. And that is how I improved my relationship also with all of you all. And I came to know you all very closely. So I'm very grateful to Dr. Kingshuk, Dr. Lavanya, and each and every one of you all who have joined, my students, my near and dear ones who have joined for this presentation. So I'll directly start with the topic, that is polycystic ovarian syndrome and its management. Yes, next slide. So polycystic ovarian syndrome is a multifaceted entity that has an effect on the reproductive system, metabolic functions, and psychological health throughout a female's life. The causes are varied and quite complex. It can include a range of factors such as genetic susceptibility, hormonal imbalances, insulin resistance, and obesity-related mechanisms. Steen, Irving, and Michael Leventhal first described PCOS in 1935, identifying anovulation as a feature of ovarian cyst. This common female endocrine disorder affects females with around 2.2% of to 26% and has been studied mostly in adult women aged 18 to 45 years old. Slide. Next slide. So it's a complex disorder with multiple phenotypes, and there are 4 recognized types. So this is mainly for the students. I think it is just a revision for you all, particularly third years. And those who are like in fourth years are already aware of this complaint, which is nowadays seen in the younger age groups very commonly. So it is of 4 types: hyperandrogenism with oligo or absence of ovulation and polycystic ovaries, hyperandrogenism, oligo and anovulation. So there are 3 ways of presenting hyperandrogenism and polycystic ovaries. Next slide. Slide. It is important for clinicians to accurately determine a patient's phenotype because each phenotype has different long-term implications on health and metabolism. The diagnosis can be confirmed if there is presence of any one of the 4 typical PCOS symptoms, which include menstrual irregularities, signs of hirsutism, presence of acne, infertility due to anovulation with ultrasound suggestive of polycystic ovaries. Next slide. So as you can see, this is pictorially represented. The clinical symptoms are hirsutism, menstrual irregularities, acanthosis nigricans, obesity, acne, insulin resistance, and metabolic syndrome, sleep disordered breathing, fatty liver disease. So you can see the hirsutism. So this is a syndrome basically, and we should be aware of these triad of symptoms which are present. Mainly amenorrhea, that is oligomenorrhea or absence of menses, then hirsutism, which is present in a few, and also at times infertility can come up. So the patient will have tendency to weight gain. So that is also clearly mentioned here. Next slide. If the ovarian morphology on ultrasound suggests no abnormalities, then diagnosis is confirmed by biochemical testing to estimate increase in the luteinizing hormone levels, fasting blood glucose ratio less than 4.5, and elevated testosterone, excluding late onset congenital adrenal hyperplasia. Most widely accepted diagnostic methodology for PCOS is Rotterdam criteria. According to this criteria, a positive diagnosis of PCOS can be made if a patient presents with 2 of the 3 symptoms. So any 2 of the 3 symptoms you all should keep in mind, that is clinical and biochemical signs of oligo and anovulation, hyperandrogenism, and ultrasound findings of polycystic ovarian morphology. Next slide. Hyperandrogenism is a key factor associated with the pathophysiology of PCOS. It causes dysregulation in the gonadotrophin releasing hormone secretion, which is partly due to abnormal feedback by estrogen and progesterone. Now, all this you all have studied in third year, so it's just a revision for you. This leads to the abnormality in gonadotrophin secretion and excessive LH secretion, which exacerbates the dysregulation in growth of ovarian follicles, hence resulting in increased secretion of androgens from the thecal cells. Next slide. Insulin resistance is another important factor leading to adiposity in the viscera. As I told you, there is weight gain and dysfunction of the adipocytes. These factors are responsible for the production of sex hormone binding globulin by the hepatocytes, which increases the concentration of free testosterone and further exacerbates the dysfunctions related to hyperandrogenism. PCOS can present with a variety of symptoms, which includes amenorrhea and infertility with signs of hyperandrogenemia associated with disturbances in metabolism involving resistance to insulin and dyslipidemia. Next slide. It is observed that women suffering from PCOS have reduced fertility and also likely to have increased risk of hypertension during pregnancy, preeclampsia, and diabetes mellitus. They also have a higher prevalence of mood disorders, which includes depression and anxiety, and are at elevated risk of developing endometrial cancer in comparison to females without PCOS, especially in premenopausal period. Next slide. Now coming to the management. The management focuses on symptomatic treatment to prevent long-term complications. Effective lifestyle changes have to be implemented, including adoption of active lifestyle, maintaining a balanced and healthy diet, avoiding unhealthy eating habits, weight reduction in overweight individuals, and practicing stress management techniques. Homeopathy is a drug therapy system that follows the law of similarity. Individualization is based on the response of an individual to an unfavorable environment observed through the derangement of life force as signs and symptoms in the emotional sphere, intellectual, and physical levels. Next slide. So you can see the PCOD diet, which includes. Yeah, can you put slideshow? So PCOD diet includes chia seeds, flax seeds. Yeah, next slide. Next slide. Yeah, correct. Yeah. So PCOD diet includes chia seeds, flax seeds, fishes, organic brown eggs, spinach, raw guava, gooseberries. I think you all can see the diet chart what I've written. Low estrogen diet tips, that is eggs, nuts, citrus, legumes. So these are the recommended products. Red and green leafy vegetables and fruits, sprouted grains, sea fish, organic goat or sheep milk, almond milk, coconut milk, flax milk, and you should avoid fatty meats, processed sugar, soy products, fatty cheeses, butter, smoked meats, fast food, red meats in excess, processed sugar, and refined carbohydrates. Next slide. Polycrest homeopathic remedies selected according to the law of similars will contribute significantly in the treatment of endocrine disorders. Firstly, the most important yogic principle states that human body is regarded as a holistic entity. Comprising of various dimensions that are interrelated and from each other. Health or illness in any individual dimensions adversely affects others. Secondly, it highlights the uniqueness of individual needs. Hence, the practice of yoga must be tailored to acknowledge the individuality. Yoga combined with medicines has proved to be effective in treating symptoms of PCOS. The holistic approach of homeopathy and practice of yoga can efficiently treat the complex symptoms of PCOS. Next slide. I think it will be a bit monotonous if I continue with the theory part. It will be better if I show you all a case and it will be more interesting. I think all of you all are interested in hearing a case about a case which was treated during the course of my research. I had got the grant from RGHS in 2019. But as you all know that the unforeseen situation because of COVID, it was difficult to get cases in an interior place like Derlagate. But after keeping a cap, I managed to get the required number of cases after a period of 1 year, where I started the research in 21, finished in 23, and submitted in the beginning of 24. and got to our Genesis specialty clinic at Father Muller, Derlakate. And you can also see the male. I have written Mrs. S and Mr. P, not to reveal the identity. The age of the female was 29 years, male 38 years. The female was diagnosed with PCOD, and I'll even show you all the reports. This was one of the case in detail I wanted to show because of the limited span of time allotted to me. But eventually the patient even conceived. So the date of case taking was 24/1/22. Next slide. You can see the husband's report where he was the sperm count was only 3 million per mm. Next slide. Slide. So he had oligo. You know that the oligospermia or azoospermia also we are able to treat by using homeopathy medicines. Now the cause of oligospermia here was bilateral grade 2 varicocele. As you can see in the report. Slide. So you can see the thyroid function tests were done to rule out other causes. And you can see the thyroid function tests were normal. So she came with all these reports. Next slide. Slide. You can see the ultrasonography of pelvis. The report which she brought showed multiple follicles, 8 to 10 mm. And you can see that no dominant follicle, multiple follicles recruited. And you can also see that they are considered a particular drug to be given. Next slide. You can see fluid present in the pouch of Douglas, collapsed follicle. The scan which was done on 23/11/21. Next slide. And here you can again see the scan repeated after where the ovaries are normal in size and the right ovary is containing a follicle. You can also here when she was taking the treatment, this was the scan taken during the course of treatment. Now the colonic constitutional totality was taken up, was worked out, and on the basis of that, Natramure came up as the constitutional remedy, was given in 200 potency initially for 2 to 3 months. And then Natramure 1 was followed up with Natramure 1M once in 15 days for another 2 months. Next slide. You can also see the previous investigation where all of you know that in PCOS we have luteinizing hormone where there's a surge. So see the surge in the LH. You can also see the FSH level 7. Here it is much more, that is around 18. Next slide. You can see the patient's USG report where there is a single fetus shown, and you can see you can see the pregnancy scan, that is the antenatal scan. So this was done on 14/12/22, and you can see all the parameters are normal. So you have seen the reports also of the husband who was having oligospermia due to bilateral grade 2 varicocele. To tell you, the remedy given there was Lycopodium 200 weekly once for the husband, along with rhododendron 30 as an acute remedy, which is very good in treating varicocele. So whenever he had complaints of pain or after seeing the cause of oligospermia in this case, I had given rhododendron 30, 4 pills 3 times a day, followed by the constitutional remedy, which cured the case, Lycopodium 200, 4 pills once in a week, then followed by 1M once in 15 days for another 2 months. And also there is a testimony. So I think for that he'll have to end the show and then he has to share it. Next slide. Next slide. Yeah, so this is a single live fetus with maturity of about 12 to 13 weeks. Okay, next slide. This you'll have to end the screen, end the show. I think you'll have to, yeah, and you can show the video. I'm showing. Yeah, can you go back? Can you go back? Yeah, this video, can you, no need of screen, what to say? Yeah, please play the video. I think you'll have to end screen. Sorry, end show. Yeah, now you can play. So he's giving a testimony that he had infertility for 5 years. Yeah, open. Yeah, you click on that, click. So he's the patient, Mr. P. I think volume you will have to increase because... So are you all able to listen? You can show the whole video and then you can change the slide. This is only one of the cases which I have shown you all due to the limited span of time allotted to me. Yeah, there are more than around 350 to 400 cases which I've treated over a span of time. So this is a gist of a few cases which were treated during 2 years of PCOS. Next slide. This case, menses irregular since 3 years, acne on face. The first case, you can see the repertorization was done using Murphy's repertory. And the remedies which commonly came up, like the first case, if you can see, pulsatilla 1M was given as the constitutional. And I've just shown a gist of 10 cases here because it was during that span of time only when I was doing the research. So multiple follicles were dominant, follicle measuring 5 mm. But multiple follicles are present, cysts are present. But after the treatment, no sonological abnormality detected and the cysts are absent. So we have mentioned the SCR numbers here as we are not able to, in a sense, we are not in the master chart, it's difficult to display the report. So I've just shown the repertorization. By using Murphy's repertory, you can see phosphorus and other drugs have come, but pulsatilla covered the patient's totality, and that's why that was considered. I'm not able to make it big. The second one is menses irregular. So you can see the remedies one by one. The second case, natribure was given as a constitutional remedy. So again, you can see the mental generals taken, physical generals, characteristic particulars. So we have gone for that. And then on the basis of chronic constitutional totality only, these remedies have come up. Next slide. So I think you can see that. The third case also, pulsatilla has come as the constitutional remedy. Fourth is phosphorus. So all these cases, what I've done is I've always started with 200 potency depending on the susceptibility of the patient. At times, the susceptibility of the patient, depending on that, I've given even high potency whenever required. Now, if it was a very tough case where 200 didn't work initially, then I've gone directly to 1M and repeated it at times even weekly for some patients. There was one very difficult case where the girl was getting menses only once in 6 months, and there was a time, it seems that even a whole year she had not got menses. So this was where pulsatilla 1M had helped her as a constitutional remedy, and now she's regularly getting her menses. And even the PCOD also, the scan had become normal. So next case. This is just to show you a gist of the cases. Next one is, again, you can see here pulsatilla 1M was given. And the next case, phosphorus 200 was given as the constitutional remedy. was multiple follicles, and then again, on the basis of all these mental generals, physical generals, and characteristic particulars, you can see the rubrics taken for repertorization. So here, chicken, aggravation, fastidious, then fear, patient is having fear, then so company, desire for, so etc. You can see all the symptoms. Okay, next slide. So next also, again, you can see natramur being given as a constitutional remedy. And here pulsatilla is given directly. 1 m is given in high potency. But here you can see the multiple follicles are still there. So the patient has not improved. Yes. Next slide. So again, you can see the repertorization done with using Murphy's repertory, where there are different remedies which have come up, but we have thought of natramur 200 as the constitutional remedy, where there is history of weight gain, menses irregular last 3 years, and patient is like very bold patient. So even phosphorus came up as the constitutional remedy. When talking to her, personally, what happened is I got important features like she has craving for fish, craving for spicy food. Age, you can see she's a software engineer. Fear for, 1 minute, yeah, cravings for spicy food. And even menses irregular, even acne on the face. And she had also, when she was studying, she had a lot of homesickness. And very recently, she had joined work and she was working. And she was not expressing her grief. She was keeping much to herself. So on all basis of all that, many remedies came up, but then natramur was selected as the constitutional remedy. The next case is lycopodium 1 m was given. So on the basis of patient was very dominating, then also consolation, amelioration, then very egoistic. So cysts, so you can see cysts, ovarian cysts. So we get specific rubrics also in Murphy's repertory. And there was a history of psychosis, but constitutionally lycopodium came up. So lycopodium 1 m was given. And then the USG showed no sonological abnormality, and the patient improved. So next slide. So I think you all came to know about a few remedies which what commonly came up during this research, where pulsatilla, phosphorus, natramur, lycopodium. Now we all know what sort of patients these are. Now the pulsatilla patient usually will have tendency to weep easily, better by consolation. Patient has got craving for spicy food, and also sometimes rich fatty food. And then when you console the patient, patient feels better. Patient is very fearful. All features we may not get in all remedies. The way to differentiate is, like, patient will be thirstless in pulsatilla, whereas in natramur, all of you know that the patient is thirsty. And the most important aspect what I came across in all my patients is when I spoke to them personally, more than the students having taken the cases in the OPD, or if I have taken a case directly. For example, the natramur patient where I had taken in the specialty clinic, which I showed you. So I had spoken to her on my own, and I got so many important features like her cravings, where she likes more of fish, more of spicy food, very much an introvert, doesn't want to express her problems. I also ruled out in that case, you might have seen that thyroid complaints were like thyroid hypothyroidism was ruled out, and PCOD only came up as the diagnosis in her case. And other than that, patient was not better by consolation. She wanted to stay in a closed room. She doesn't want to weep in front of others, doesn't want to show her feelings in front of others. But when you speak to her, she's very reserved, even not relating her problems to you. But since you're the doctor, she relates to you very freely. Only to the ones whom she's close, she'll relate. And natramur patients mostly will be always in a hurry, and they'll be worried. The other common remedy which came up for me during this research was phosphorus. So as you know, the general, very friendly people, very also easygoing people, they take things very lightly. But At the same time, they are very intelligent, and they're able to cope up with situations, and they are also good in extracurricular activities. They are very friendly people, and you can ask them. Now suppose the patients don't tell you, and tip for the students, suppose the patients ask you that, suppose that in case you are having a doubt like whether to select natramure or phosphorus, you have seen many cases here. What I showed you, among those 10 cases, natramure and phosphorus came almost close, and phosphorus came as the highest remedy. But when we spoke to the patient on one-to-one basis, what I came to know is, like, the patient has got is having some kind of fear. What is underlying? At times, patient had fear of thunderstorm, fear of lightning. Then very bold on stage, taking at times they are very good performers, whether it is dance, whether it is being artistic, or whether very friendly natured. Even at times they might be good in stitching. Yeah, artistic, that is one thing what I told. And they like company, they like in the sense they also are very intelligent. They remember like whatever they study very fast. So generally when you speak to this, because this age group, they'll be usually either studying or working. So this age group, very rarely this condition is seen after 30 years. So if you see, mostly phosphorus also came up as a constitutional remedy. That's why I'm highlighting more on phosphorus and natramure during this study. Other than that, very other important drugs also came up, like silesia, sepia, which I gave for a few patients. I still remember. So let us see a glimpse now of the research what was done. Now this was a randomized, non-controlled clinical trial with an open label trial. Randomization was done by sealed envelope method. As you know, the trial was registered under clinical trial registry on 24/5/2019. But due to COVID, it got delayed for 2 years, and our actual work started only in 2021. So the ethical clearance was got before the research. Next slide. Next slide. The study was conducted at Father Muller Homeopathic Medical College and Hospital, OBG OPD, over a duration of 2 years. The data was collected from females in the age group between 18 to 36 years, consulting for treatment of menstrual irregularities along with associated with PCOS. Relevant data through detailed case taking was recorded in the case format after obtaining informed consent from the subjects. I try to take, although in Father Muller's they give permission like to take cases generally from all units, I restricted myself to take my own cases because I wanted to do a genuine study, since Rajiv Gandhi had so much faith in me and gave me the grant. So I wanted to do it a very genuine study, and because of that, I am well aware of all the cases which I have treated, and I am able to tell you the results which I obtained, the remedies which I used myself I have given, and the way I have gone about, right from 200, then I've gone to 1M, then I've gone to writing part was helped by even the other authors. As you all have seen in the beginning, I mentioned their names, Dr. Jolly and Dr. Prema. But the treatment part, as far as possible, I try to restrict itself to the cases got in OBGA unit, which my students are well aware of. Because at times when I used to take classes for them, I used to always show the classes in the classes, the cases which conceived. So that was commonly showed from time to time. At the same time, especially for OBG classes 3rd year, and at the same time, I used to also show some good PCOD cases, which were extremely tough. So by the grace of God, I was able to treat all these cases only with the grace of God. So I'm really grateful. At the same time, our hard work and our determination to get results in tough cases really stands up when we see the results. So you can see the data was collected from females in the age group between 18 to 36 years. And also we have taken informed consent. So the next slide. The sample size calculation, effect size was 0.6 at 98% confidence interval and 90% power. The required sample size was 62 cases, 31 in each group. Inclusion criteria, females between the age group of 18 to 36 years. Rotterdam criteria was used to diagnose PCOS. I think all of you know, I also mentioned that either 2 of the 3 criteria. So we had used Ferryman-Galway scale so that we are able to ascertain whether there is mild hirsutism, moderate hirsutism, or severe hirsutism. So that was also one of the criteria. Plus we did testosterone. Testosterone was not significant at all because only one case showed high testosterone level among all these 62 cases. So definitely it was not diagnostic. So even our co-investigator, Dr. Prema Dekuna, who is a well-known obstetrician and gynecologist, so she herself said that that we can select 2 out of 3 criteria, which will definitely show that whether homeopathy is having good results along with yoga. So we wanted to compare and see which is better, whether homeopathy is better or homeopathy and yoga is better. So I just wanted to show a glimpse of this research to you all also. So subjects opting to lead a healthy lifestyle and willing to practice yoga were included in that group 5 days in a week for minimum duration of 30 minutes. Next slide. Exclusion criteria: subjects diagnosed with diabetes mellitus, Cushing's disease and increased prolactin levels, subjects with thyroid disorder, as I had shown you that case, subjects suffering from adrenal tumors. Yes, next slide. Next slide. 31 subjects received homeopathic medicines and 31 subjects were enrolled to receive homeopathic medicines in combination with yoga therapy by a professional trainer. We have got a yoga trainer at our hospital, and who is employed, and she used to regularly see these patients, and she called them according to her convenience and also according to the patient's convenience from time to time. So sealed envelope method was used to recruit subjects to receive the treatment modality. Subjects were scheduled follow-up for 9 months at a regular interval of 1 month to analyze the treatment outcome. Next slide. Next. Hyperandrogenism was evaluated before and after treatment, though laboratory investigations of serum testosterone levels were normal. So definitely when we saw, I told you only one case, excepting for one case, the assessment of hirsutism was based on Ferryman-Galway scale, where I said about normal score less than 8, mild hirsutism 8 to 15, moderate to severe hirsutism score more than 15. Absence of terminal hair, 0 score. Next. Next slide. You can see the classification according to age, classification according to religion, and you can also see the classification according to marital status. Next slide. Profile, you can see which came. So this is very important. Calcarea cup 200 has come. Then Calcarea cup 1M was given in few patients, because by giving Calcarea cup 1M, by the time already the result was achieved. Again, you see Pulsatilla 200 was given. Pulsatilla 1M also you can see. Phosphorus 200 in maximum, many big group of patients. Phosphorus 1M for some time. Lycopodium 200 also given as the next remedy. You see Natromur is the highest. Natromur 200 is given highest. 1M is given maybe following that for 1 or 2 months, and 10M only very less. Silesia 200 also came in a few cases. I also told you all about Sepia 200. And you can see that it was followed for 6 months, and then at times 5 months, 4 months. How many cases were followed up for 3 months, 2 months, 1.5 months, 1 month, then some even days. And how the regularity of menses, how fast it came up in some. Some took quite long time for the regularity of menses. It took 6 months, but some as early as 24 days, 25 days also, they were in the next cycle itself, they were better. And there were a few patients during this which conceived, which I showed you all also. So 10, and here you can see. See that there are a few number of patients who conceived also. So if you see in yoga and homeopathy, yoga with homeopathy as well as homeopathy, in both the patients have conceived. So at the end what we got is, we found that homeopathy and yoga are equally effective in treating PCOD. So although we thought that homeopathy and yoga will be a better alternative than homeopathy alone, but you can see that at the end you will come to know. Yeah, next. The next slide. Now the discussion is the objectives of the study was to assess if menstrual cycle could be regularized and hyperandrogenism reduced by interventions in females suffering from PCOS. The data was collected from the patients visiting the homeopathic OBG OPD for treatment of menstrual irregularities diagnosed with polycystic ovarian syndrome in females aged between 18 to 36 years. All the subjects of PCOS were diagnosed as per Rotterdam criteria. 31 subjects were administered constitutional homeopathic remedy and 31 received constitutional homeopathic remedy along with regular practice of yoga. Each subject was followed for 9 months at a regular interval because according to the rules of research, some got the results very early as I showed you. Some got menstrual cycles and all was achieved very soon. Each subject was followed up but for 9 months. Even if they didn't come, we always followed up in the sense we called them for investigations to evaluate the treatment outcome. Next. So it was seen that both interventional groups are equally effective in regularizing menstrual cycle. PCOS patients treated for menstrual irregularity with constitutional homeopathic remedy and yoga therapy, 64.52% achieved regular menses, while patients treated for menstrual irregularity with constitutional homeopathic remedy, 61.29% achieved regular menses. So what happened is the chi-square test showed P is equal to 0.793. So a senior most statistician has evaluated this from Father Mullah Medical College, Kankanadi. She happened to be my friend, so I was very lucky. So she actually evaluated it properly and not only very accurately. So that's why even we are getting that small percentage difference also, where homeopathic remedy, it was 61.29, but she said that it is not significant. So that's why we almost thought that homeopathic treatment and yoga was at par because there was no much difference when yoga was administered as well as, but significantly if we check, we can see that definitely lifestyle measures, dietary measures, yoga will help the patient to be more particular about regulating the lifestyle, following a particular pattern, adopting a healthy lifestyle, because yoga is not a therapy, but mainly it is one kind of treatment where therapy, where it is not a particular treatment given, but it is a therapy where it makes us to be very systematic, regular, and we, along with our homeopathic medicines, it suits and it really helps for most of the patients. So that could be one of the reasons. But she told us that the chi-square test is B being 0.793 is not significant. So as she has we have mentioned, as we are not, it is not our specialty. So we have taken the opinion of the statistician. Next slide. Hyperandrogenism was assessed before and after treatment, as I told you, by laboratory investigation of serum testosterone levels. So this was done, but as I told you, it didn't help us much. Ferriman-Galway scale helped us a lot. Around 61 subjects suffering from PCOS did not show elevation in testosterone. So this is the same thing I told you. Then 0.06 to 0.82 nanogram per DL, except one with significant reduction from 0.937. I told you there was only one case in the interventional group. That also she had taken up yoga. She was brought by Dr. Prema only actually. She was the only one who had high testosterone level. But it came back to normal. You can see she herself did the test. We did it at the same place actually at Father Mullah's, so that we don't get any difference in the investigations. Treated with constitutional homeopathic remedy and yoga therapy. Coincidentally, I think her constitutional also was phosphorus only. Okay, next slide. Next slide. Next slide. Signs of hirsutism were assessed according to Ferriman-Galway scale for hirsutism before and after treatment. As I told you, there was significant reduction in scores in both the interventional groups. According to statistical analysis in the research study, we observed a significant reduction in Ferriman-Galway scores in both the interventional groups, in both the intervention groups. That means homeopathy as well as homeopathy and yoga. P was less than 0.001. But any significant change of the score was not observed among the intervention groups. That is, P is equal to 0.378, which is not significant. Next slide. Only what we can see and we can observe from the studies, it has enhanced the fertility rate in females, infertile females suffering from PCOS during course of treatment. As you all had seen in the graphical representation, during course of treatment, 3 infertile subjects among 13 received constitutional homeopathic remedy and 3 of them conceived. That is among 13 of the getting only the homeopathic constitutional remedy. 3 infertile subjects among 11 conceived receiving constitutional homeopathic treatment and yoga therapy. So it shows that the interventional groups are significantly efficacious in achieving a significant fertility outcome among the infertile females suffering from PCOS. But what we can see is that both the interventional groups are equally effective in attaining fertility among the infertile females suffering from PCOS. So they are equally effective, but we can see slightly more. There is a better response in females who are having PCOD and have received both homeopathy as well as yoga. Now you can see here also the chi-square test P is equal to 0.855. That is not significant. Slide. So as I told you, phosphorus 200 has proved efficacious constitutional remedy in treatment of PCOS in the interventional group treated with homeopathy. Natramur 200 has proved to be the most efficacious constitutional remedy in the treatment of PCOS along with yoga therapy. So with yoga, we have seen Natramur has got very good results, whereas in homeopathy, we have seen that only phosphorus 200 has got good results. Now, this modality of treatment adopted was simple, safe, reliable, and cost-effective, thus made affordable to patients of low socioeconomic status. Next slide. So you can see, like, even those who could not afford were able to get the treatment and get so good results, which is not possible in allopathy because they give only hormones to regulate the menses and they don't cure the patient. It is only palliation what takes place. This research project is novel, integrating 2 systems of treatment, homeopathy and yoga. In both the interventional groups, patients suffering from PCOS with menstrual irregularity after treatment showed improvement in terms of attaining regular menstrual cycle, and there was significant reduction in Ferriman-Galway scores for hirsutism. So that is what we concluded. The serum testosterone levels were not significantly reduced. Now, this study has also enhanced the fertility rate in infertile females with PCOS in both the interventional groups. Next slide. So you can see the references when we had written the article, because for Rajiv Gandhi, we also have to submit the article. So that was a criteria in getting the completion. Next slide. Next slide. Next slide. Next slide. So our takeaway message for today is, particularly for the students and also the researchers and also other experts in the field, we should carry out clinical research in specific clinical conditions, which demonstrates the role of homeopathy with its possibilities and limitations. Specialists in every field need to come together and work towards a holistic, integrated model of patient care, which includes the positives of both the sciences. As you can see, I have incorporated the help of a obstetrician who is a senior most as Father Muller's, and also one of our doctors only, Dr. Jolly, So she also was very instrumental in helping me to carry out this research. At the same time, statistician Sucharita, Dr. Sucharita Suresh, so she too was very helpful. And in addition, like even there are some doctors from our field also who have helped me, like Dr. Kurian, who was very good in research, and at present is the HOD and professor at Yenapoya College. So I want to mention their name too. And also Dr. Sebastian, who helped me to do particularly the graphs. So I thank each and every one of you. Especially I also thank SIA, who has given me such a good platform to present this present for this webinar. And they only have displayed actually everything. When I said there was heavy rain here, so it was difficult for me. So then they have helped me to such an extent. I'm very grateful, particularly to Dr. Lavanya, who was there with me at every moment whenever I called her, and arranged everything so fast in such a short time. I thank my special thanks to Dr. Kingshuk Goswami, who has been such a good person. I can tell you, like being a young student, around 5 years back, he was interested at that time in research, and he was so good that he also started an organization of his own, and that's why this SIA, or All India Students Association, has taken place only because of Dr. Kingshuk. So my heartfelt gratitude to him, and also to Dr. Lavanya for organizing this beautiful webinar, along with all of you all who have joined together in Homeopathy 360, all the members of this association, all the dignitaries of this beautiful association, and all the core members who have encouraged us in participating, in presenting, in spite of each one having their hectic schedule. My heartfelt thanks to each and every one of you. I also thank our students and also the other dignitaries and other all the esteemed guests who have delegates who have participated in this webinar and at this hour. Thanks to one and all. Next slide. And next slide. Slide. Lavanya?
Yes, ma'am. Yes, ma'am.
I think it's the last slide. That is.
I think so, ma'am. It is the last slide, I think, ma'am.
Yes.
Okay, ma'am. Thank you, ma'am. Thank you so much for your enlightening us with your wonderful session. Respected participant, the session is open for question and answer. You are welcome, actually.
So if anyone wants to ask any questions.
There are two questions, ma'am. First question is, ma'am, is potency selection based on the size of the follicles or the totality?
Potency selection, yeah. It depends on the susceptibility of the patient. Yeah, and mainly it also depends on they are asking about the size of the cyst, or they are asking about the.
Ma'am?
Yeah. No, they were asking about what? The size of the cyst and the.
Ma'am, they are asking that whether the potency selection is based on the size of the follicles or the totality.
The totality, yeah, actually on the totality.
Okay, ma'am. And the next question, here it is, ma'am.
Totality in the sense, seeing the mental generals, the physical generals, characteristic particulars, the patient susceptibility, the reacting pattern. Yeah, the size of the cyst is not important. It all depends on the on the totality of the patient and how the patient reacts what I did is actually during my research also, and also at present when I'm treating cases, I see that I start with the potency which is most suited for the patient as a whole. So how the patient responds. Now suppose there is no improvement with the 200 potency if I've given, then I go to 1M. After I wait, like I repeat the potency for some time and only then go to 1M. But definitely it is not on the size of the follicle at all.
Yes, ma'am.
Anything else?
Yes, ma'am. There is one more question, ma'am, from the participant name is a girl, ma'am, and she want to ask that I am a 23-year-old homeopathic student and I am suffering from PCOD from 10 months and my
Okay.
weight is 55 kg. Is this the ideal weight? How I can avoid the sugar cravings during PCOD?
Actually, what is her height?
Height actually.
Yeah, height, because depending on that, like in case maybe 5'3", 5'4", maybe can it may not be so much, but what does she want to know actually?
She want to know a
Okay.
23 years old girl of 5 inches height and a weight
5
of
inches height. Okay,
55
then surely
kilograms.
our weight is little more only. Definitely our weight is more. So she should come down to at least between 48 to 50. Now for that, now she has to restrict her cravings. She has to avoid all this. As I told you, the dietary habits, reducing the refined food stuff. Now refined food stuff will include all this maida products. Then she has to eat all the whole wheat products. Then, as you know, boiled rice. Then even uh, rice restriction also should be there. There should be less quantity of rice, more of proteins in our diet, more of fiber-rich food, which is very important. Fiber-rich food. Then oily, fried foods. All this she has to avoid. And definitely sugary foods also. So definitely she will reduce her. She'll be able to reduce her weight. And one more thing is, in addition to all this, I don't know whether I mentioned, water intake should be at least 2.5 to 3 liters. What she can do is, now afternoon time, like when she has food, for example, start with some fruits. Let her restrict to eating the fruits directly, having the fruits directly, not juices. Because in juice, at times, sugar is added. Even if it is plain, also the fiber content reduces. Then she can have the course I'm saying of having food. First, she can have fruits in between meals. Then after that, she let her take the vegetable first, then followed by the rice, so that the rice quantity is very much in limit. Because in particularly here in South India, we tend to take lot of rice, less of vegetables. I don't know from which place she is, but then she has to restrict the use of carbohydrates, and she has to increase the intake of vegetables and fresh fruits, and stop like juices, because juices will definitely not help her, because fiber content will be less. Leafy vegetables is a very important factor for her. So if she controls her diet, and if she restricts carbohydrates, if she doesn't use sugar, restricts the use of sugar, I'm not saying completely cut down sugar, definitely she will do well, even without medicines. And then the indicated constitutional remedy will definitely cure her. If she has any doubt, she can even call me. So definitely I'll tell her which remedy to take. No problem.
Yes, ma'am. Thank you, ma'am. Any other questions from the participants? They are welcome.
Any questions you all want to clarify anything? Thank you for your patient listening also, all of you. Yeah, I can, my email, should I tell my email?
Sure, ma'am. Yes, ma'am.
So you all can note down my email. That is, Lobo Anita 25, LOBO ANITA 25, LOBO ANITA 25 at gmail.com. LOBO ANITA 25 at gmail.com. Even if you search, you will definitely get my number. I've done a study also on efficacy of homeopathic treatment in female infertility. effectiveness around many years back, maybe around 4 or 5 years, more than 7-8 years back, and it has appeared in the journal also, and it is also published in the clinical trial registry. It is registered there. So if you type effectiveness of homeopathy treatment in female infertility, you will get my name. And as Dr. Lavanya has allowed me to share my email, this is my email: Lobo Anita, LOBOANITA 25 at gmail.com. Definitely, being students of homeopathy, you all should, you all are welcome for any help. Whether if you all want constitutional remedy, also I can tell you what can be taken so that it will help you all. Plus, you all should maintain diet also. That is very important. So I'll even advise diet. I have written a paragraph on that. If you contact me, I can send it to you also. And if you want, you can take my number from Dr. Lavanya. Any other doubts you all are having?
I think they have cleared all their doubts, ma'am. I think other doubts from the participants. I have given your mail ID in the chat box also, ma'am.
Okay, already. Yeah, thank you so much. Yeah. So thank you, organizers, especially. Heartfelt thanks again to all of you all. Dr. Lavanya, Dr. Kingshuk, and all the entire team who has helped me. And because of you, it was very nice for me. I could present in a very natural way, and I didn't have any hesitation, only because of your help. Thanks a lot to one and all. Thanks to the participants who have been so nice.
Thank you, ma'am.
Yeah,
thank you so much, ma'am.
Thank
you, everyone, for your active participation. Special thanks to the today's guest speaker, ma'am, Dr. Anita Lobo, ma'am. Thank you all to the ISA team for this wonderful series. Thank you to our media partner, Homeo 360 Degrees. Thank you all. We'll be back shortly with the other beautiful session. Thank you all. Good night.
Yeah, good night.